It's my favorite time of week, Wellness Wednesday. Hi everybody, Wendy Bell. I want to introduce to you guys a rock star, Alexandra Dubyak, certified nurse practitioner. We're at Body by AIM 360. This is your wheelhouse. I talk about you guys every day. And today with Donna, we're doing something really special because we're talking about something that's not very sexy, the GI area and like pooping and stuff like that. It's important because this is part of our health and our wellness. Yeah. What happens here, right?
A huge part of your health and your wellness, and as you well know. So this is Donna. She so lovely agreed to come on today with us and talk about her journey. I mean, she's about 6 weeks into her program, but this is a big part of her journey is the GI aspect of things, and we see a lot of this in our practice. And I mean, we treat it all the time, and it's not an easy fix all the time, but it is fixable. So
before I let you scoot, because I'm going to shove you out of the way, this is where the $199 blood test comes into play, because until you know what's going on inside your body, you don't know what your food is doing to your insides. Is that right?
It's a starting point for sure. That blood work tells us so much about what's going on with the patient at baseline. So again, that's everybody's starting point, because it paints a picture. It gives us a foundation to go from, rather than just, I mean, listening is great. We listen to you and your symptoms, but when you have some numbers to go off.
Right on. That's the facts.
Yeah, the progression is a lot easier.
We bring Allie in because this is the body all of us aim to have. So now you can get out of the way, because I have had enough. Scoot out of the way, sister. This is Donna. I'm so excited to meet you.
Yes, nice to meet you.
I want to know, why did you come to Body by AIM 360? Because there's that moment when you're like, I got to make that call. What was that moment? Why?
Well, I was getting tired and I couldn't function, and I was like, there has to be a fix. I was listening to you on the radio about advanced integrated medical, and I'm like, I needed to. I've been thinking about this for a year, and I'm like, I got to lose weight, to feel better, you know, to have a long life. You know, so with the plan with Dr. Dubyak, we decided to change my diet according to what would help me lose the weight, according to the blood work, you know, supplements and stuff like that, so that I could lose the weight. I had to eliminate grains and dairy.
That's what I was going to ask you. Okay, so you go in, you get the prescription, you get your blood drawn, you wait a week, get the results back. What did you find out?
I found out that it was my diet, and that I needed to eliminate dairies and grains, and you know, address my cholesterol as well, you know, so I have lost 14 pounds. I was trying to do the workouts last year for 3 months in a row and have maybe lost a pound and maybe an inch or two. So without Dr. Dubyak and the plan here, I have been very successful. I love this program. You know, it's great. I've told friends about it, you know.
When you talk about this program, it's not like they're trying to push on a bunch of expensive prescriptions on you.
No.
What do they do here at Body by AIM 360 that's different than other things you've been through?
Well, they have health coaches that calls me every week for encouragement. If I'm struggling with the weight loss, like I did a couple weeks ago, was kind of at a standstill. I did an apple day, like 6 apples, and within a day I've lost almost a pound. We have a nurse that calls me about once a month, so she's very encouraging, and I'll be going here in about a week or 2 to get blood work again. You know, my goal is, you know, once I follow up with my next doctor, that my blood work will be so great that I won't have to see a specialist.
I want to ask you this. Another thing that's very unusual about Body by AIM 360 is IV therapy. So if you think about your gut, and I'm no doctor, but I can put pieces together, sister. So you think about your stomach, the things that you're eating, and if you've got issues with the things that you're eating and you need certain stuff in your body, you've got to bypass this to go, right?
Absolutely.
Have you had IV therapy, and if so, what do you think?
I love it. I come about every other week for the IV therapy. It takes about 20 to 30 minutes, and I feel energized. It's been great. I've never had so much energy in my life getting these IVs.
Really?
Yes, absolutely.
So you're driving how far to come to Body
An
by
hour and
AIM
a half
360?
to an hour and 45 minutes, depending on traffic.
What?
That's amazing. Yeah, I want to lose this weight, so I'm very committed to doing this.
Tell us about the app. Do you use the app?
I absolutely do the app every day. It may be later in the night. It tracks my weight, sleep, bowel movements, food, so I can see like how many calories I've eaten and how many carbs compared to fats. So I just love that. It's very helpful to me to track, to see what foods, are the protein compared to the carbs.
That's fascinating. What have you cut out of your life that you didn't know was harming you?
Well, I knew that the junk food was,
Right.
and certain things, like there's like bananas that I don't eat right now, but I do eat like the apples and oranges. And you have to watch the meats. You can't eat the real fattening meats and stuff like that.
You're learning.
Yes, absolutely.
You're learning, and you don't have to like stop enjoying life.
Absolutely.
It's just knowing how it all pieces together.
Absolutely. So like for lunch and dinner, I do 6 ounces of meat and 6 ounces of vegetables, and then I have like the snack in between. And for breakfast,
I love it.
I have the fruits. and
Are you
stuff.
eating more or less than you used to?
Probably less.
Nice.
Absolutely less. And then I do my exercise that I track too on there. So it's limited with the 8 to 9 and 900 to 1,000 calorie a day diet. I do like 14 to 28 minutes a day on my Bowflex machine.
I'm so happy for you.
Yes, me too.
What's your goal?
My goal is to be down around 150.
That is amazing.
Yes, so I got like about 20 some pounds to go yet.
Rock on.
Yes.
All right, so people are outside out here looking at you and they're saying, all right, she sounds like she's doing a good job. I'm kind of nervous. I don't know if I can pull this off. What do you say to get them to pick up the phone?
Try it, get the blood work. It's $199. That way they can make an individual plan for you according to your blood work, whether it's like the cholesterol. For me, I was pre-diabetic and didn't know that. My doctor office ordered me a fasting blood sugar that didn't show diabetes, and I have a family history. So with this blood work, it did show pre-diabetes.
You got answers.
Yes, absolutely.
And that's empowering.
Yes, very empowering.
I'm so jazzed for you.
Yes.
Good for you. You're only just beginning, babe.
Yes, absolutely.
Right?
Yes, that's right.
Here's all you need to know. BodyByAIM360.com, 412-227-9255. Simple as that. Your journey doesn't begin until you pick up the phone. So do it. From Donna and me and our friends here at Body by AIM 360. Until next time, peace everybody.